Dame Kate, your task doing the Vaccine Taskforce was to source a vaccine, scale up capacity, build capability in vaccine development, then make for the provision of international distribution, and then strengthen the UK's capability for resilience for future pandemics, which actually sounds exhausting just reading it all out. There's so much to talk about that, and also about future-proofing against pandemics. But if we kick off with what you did in the Vaccine Taskforce, what was the single biggest lesson you learned in that whole process?
I mean, the single biggest lesson was probably getting the right team together and having a clear mandate and empowering the team to actually do the work that we needed to do. Because everything was in a rush, because every day we took, more people were going to die. So the first thing we did was to actually put together the experts from industry together with the experts from government and agree this is the strategy and this is how we're going to do it. And because there was so much uncertainty, what we did is put in place a very focused set of meetings 3 times a week, so that we at least had a framework with which to actually start communicating what we were doing and talking about progress. So getting that team together, getting a diverse team together, actually. So we had plenty of women who brought real depth of skills alongside the men we had in the team. In terms of learning, diversity of skills, people, thinking, backgrounds, made for a really effective team. And without the team, this couldn't have happened.
Now it was a success, it's transformed everyone's lives, that the vaccine rollout worked and the vaccine was found. But when you were contemplating this at the beginning, did it occur to you that you were most likely going to fail?
I knew it was most likely to fail. And there were so many reasons why it was likely to fail. The first thing was that we had no vaccine against any human coronavirus. So we had no template or playbook to follow. The second thing was that vaccines historically take 5 to 10 years to develop. The quickest was at 4 years, and that was done 50 years ago. And we didn't know anything about this new virus. So we had so many reasons to be sceptical that this was possible, and to be able to go from sequence to start vaccinating people in a year, which is what we did, was not what we expected to do at the beginning, because we knew that most vaccines fail.
You're obviously a very successful person. Was there a moment you thought, this is kamikaze, I'm setting myself up for failure? How did it come about that you took the helm?
The reason I was asked was because Patrick Vallance had set up an expert advisory group to advise the government on the procurement and identification and procurement of vaccines. And he then invited me to join that advisory group. And my job for the last 30 years has been to develop novel drugs to treat unmet diseases. And so when Patrick then asked me to join the expert group, I asked him why, since I don't know anything about vaccines. And he said, but you understand the small company landscape. And it's that innovation landscape which is actually where the bulk of the vaccines have come from.
So he brought you in because he knew you from industry, but then the Prime Minister personally called you up.
Correct.
And asked you to do it.
Everything's done by text. Okay. So you get a text saying, can you speak? So I first got a text from Matt saying, could I speak? I then spoke to him, and he then said the Prime Minister had asked him to ask me to do it. I then said, I want 24 hours to think about it. And 24 hours later, I went back with a list of conditions on the basis of which I would do it. And having established that, then the PM called me.
And that was to seal the deal then, really?
That was to basically accept the conditions, which was 6 months, that I reported to the PM, that I would have a quick decision-making process, that I could hire my own team to be able to get on and do it.
I mean, did you have this moment you thought, I'm going to fail, this is awful, I've been asked to do something, I've got to do it because the PM's asked me, we're in the middle of a pandemic, and I don't know if I can do it?
So, absolutely, I had that entire imposter syndrome, I can't do it and I'm not the right person. And that was because I'm not a vaccine expert. But while I do therapeutics, so what I'm very familiar with is how do you develop new drugs and in patients. But those are for patients who have a disease. Putting something into people who are healthy volunteers is just a little bit different, prophylactic vaccines. And so when I was called, I hooked on the vaccine as being, this is what they're wanting me for. But actually they're not. What they want is someone who can do basically what venture capitalists do, which is put teams together, build plans, figure out milestone-based events which are key to actually the success of the development of the, whether it's the therapeutic or a vaccine. And so there's lots of the style of how venture capitalists work is what was needed here.
And the venture capitalist mindset and then Whitehall, they're kind of different, culturally different, very different things. You presumably met quite a lot of resistance. That's my first question. Then my second question on this is that, is the venture capitalist mindset only applicable in the public sector when it's an emergency situation?
So 2 questions. On the, did I meet resistance? Not really, is the answer. So I had absolute support and cooperation from the PM. And actually, if you've got that top-level leadership, it is incredibly helpful.
Right.
And I established up front that we were going to be putting money at risk without knowing if any of these vaccines would work. So it's what the Whitehall calls no regrets funding.
Right.
And so we'd established the principle that if we wanted a vaccine, we were going to have to put money up front.
There was a lot of scrutiny around you, the fact that you were married to a Treasury Minister. You know, it was all these sorts of this charge about being part of the chumocracy, if you like, and there you are doing this incredibly hard job. And not being paid to do it. Did you ever have moments when that happened, thinking, I've been asked to do it, I've stepped up to do it, and now I'm being publicly criticised? You didn't really have a right of reply. Did you just sometimes think, why have I bothered doing it? Like, why the hell am I doing it? Did it annoy you?
Of course it annoyed me. The challenge is, this all happened just only a few weeks before I was due to finish. And by then, we'd put it all in place.
Yeah.
Had all that happened early on, we might well have ended up in a different place. But
What, you might have walked, you mean?
Or it just may not, we never would have achieved what we achieved. The advice I got was incredibly clear, which is take your ego out of this, focus on what you're doing and move on, because this will all pass over.
Did it hurt?
And it did.
Yeah,
of course it did. Yeah. It's very bizarre when you're not used to being in that world, to have a whole lot of people say a whole lot of lies about you and you can't respond. I mean, it's really bizarre. Lily Allen has a great song, and so I used to go running in the dark with a head torch on, listening to Lily Allen, and it was great. And I'm not going to say the name of the song in public.
Will I be able to guess it?
Yeah.
I watched your Romana's lecture. You gave it in Oxford in 2021, and you spoke about how your father, your late father, Lord Bingham, had been honoured giving that lecture. Was it 19 years before you gave yours, or 18? It was one or the other. And you talked about, you spoke about how he talked about the vulnerability of personal freedom in times of crisis. And then I saw you paused and you needed to kind of collect yourself. And when you spoke about your dad, what was in your mind at that moment?
I caught Mum's eye, who was sitting in the front row, and I'd practiced it and I'd said it so many times, so it wasn't as if I was saying it for the first time. But then seeing Mum sitting there, that's what absolutely triggered me. So I then had to say, just stop. And
it was actually a lovely moment,
Yeah, it wasn't. It absolutely. But it was unexpected for me. But
well, incredible that you followed your dad as well. And one other question about him: as I said, he was widely regarded as the greatest lawyer of his generation, one of the most senior justices in the land. How did he influence you, your dad?
Not to go into the law.
Okay.
So I went and did. I mean, I was very keen. I think to carve my own path, and that's why I ended up in science.
Yeah.
So nobody else in my family does science. Nobody else does sort of small businessy, innovation, risk, that sort of thing. So I think I'm just a maverick.
Right, let's quickly get on to future pandemics. COVID, is it over?
What we know is we had Delta variant that was really very serious last year. We're now in the middle of Omicron. This could continue to evolve, and new variants could outcompete. The question is, will it ultimately end up as a seasonal flu type disease? And we hope that is where it will end up, so that there's sufficient levels of immunity that we won't have this.
Well, Kate, I mean, Patrick Vallance, when I've gone to the press conferences, he has talked about this transition from pandemic to endemic, or epidemic.
Endemic.
Where it does become like the seasonal flu, but you say it's still not clear.
I don't think it's quite there yet.
Right.
And so to the extent, I mean, the stat we heard this morning was 10% of children in the UK have COVID right now. So that is still a vast level of viral transmission and presence in the country. So we just don't know yet what the remaining drift and mutations could be.
Is the government ready to scale up in the way it did before, should another virus come along that really threatens the public?
Well, a lot of the scale-up has been done. So part of what our job was in 2020 was to put those plans in place. So we basically took the existing ecosystem for vaccine manufacturing and scale-up and 9 different sites around the country. We have now funded to scale up into much more significant capability. So we've got a lot more capability here now.
You talked about having someone in government that's responsible for this,
Yes,
right?
I mean, I think we should be treating it like we treat defence, because, you know, we're much more likely to get another serious pandemic than we are to be invaded by somebody.
So what, a pandemic minister?
Yes, but really serious, not just a...
Cabinet minister?
Yeah, absolutely.
Okay.
And it needs to be somebody, ideally, that comes in, I think, that needs to have that private sector experience.
Have you suggested that to the PM?
Yeah, of course.
And what did he say?
Oh, they'll take all those suggestions. Well, ultimately, transpires, I don't know.
Do you think that we have finally killed the stereotype that science is a boys' subject?
I mean, there's a lot of very, very punchy women who were absolutely instrumental in the whole initial COVID response. No, I don't. And I think it's partly because we don't teach our kids in school as to what you can do in science. So people, I still think of scientists as being, you know, men in white coats. Well, actually, it's not that. If you think about what we're dealing with in technology, whether it's phone apps or cybersecurity or how do you deal with climate change, and as soon as you start saying, well, all of those are underpinned by scientific understanding, actually, that's what's going to get people excited, because these new, you know, younger people now, they absolutely want to help save the world.
Do you think it's a coincidence that the people heavily involved in this vaccine were women?
I think women are very good at problem solving and just getting on with it.
As you did. Well, look, thank you so much. Thanks, Kate, for talking to me. I appreciate it.
Pleasure. Thanks for having me.